Hello, I'm Dionne. I'm a fifth year medical student and I'm currently on my fifth week of placement where I've been doing paediatrics at a hospital in Fife. So I have OSCEs coming up in the next few months. So it'll be based on my paediatrics block and my next block. So I'm feeling a little bit nervous, but hopefully not too much. Luckily, I have done them before, so that helps actually, because previously it was a big fear of the unknown. But having done OSCEs before, I know the structure, and I think that's the biggest thing. It's knowing how is it actually going to work, and actually understanding the structure of it now and how it's timed and what you need to sort of be prepared for. That's a big element of OSCEs. So I think the fact that I've had the experiences two times now, I'm quite prepared in that sense, but actually you also have to know obviously all the knowledge and the things that go along with it as well. So to prepare myself, the best thing, and I realised this last year when preparing for OSCEs, is you need to practice. You need to practice and practice and practice. And it's especially helpful to practice with other people. You can give each other feedback, and that's always really helpful, because if you are just practicing sort of by yourself, and I know that sometimes there's a place for that. Sometimes people practice with teddy bears and things like on your own, just kind of getting used to sort of procedures. But what you forget is if you don't know something, you don't know it, and you might not realize that you don't know it, but someone else will be able to notice that. If you've skipped something, if you missed it, we kind of have our own internal biases. So when you're by yourself, you might think, oh yeah, I did that, I did that, and I did that, but actually you might have missed something. So having other people there to help you and guide you, tell you what you did well, obviously, but also maybe what you could do better or what you missed, and continually doing it. And then also being an assessor sort of for other people as well. I think that's really good for your learning, because again, it shows what you know. And if you're able to actually give people good feedback, it shows that you actually have a relatively good level of understanding of something, I think. So practicing with other people. And I think what else would help me would be probably more formal practices. So that would probably be through university, through people that formally mark OSCEs and things as part of their roles, instead of just other students. We can be maybe we're nice to each other and things because we have that sort of empathy for each other. We understand what we're going through, whereas someone else will just be very objective and in their feedback. And it's good to sort of get feedback from people that are experts in it. I think it will just be a lot of practicing with others, with some helpful volunteers as well. If you can get your family and friends involved, then that's great too. Actually, that's a good point as well. Sometimes your family and people who aren't medical is actually a really good they're really good to practice on, because they'll also notice things, and more so not so much the medical side of things, but actually the sort of interactions. Like if you walk into a room and you forget to say your name or ask their name, or things like that are actually a big cause that people might fail, actually, just for simple things like that. So I think actually having like family and friends, they can tell you if you've missed, well, you didn't really ask me much about this, or I felt like I had more to tell you and you didn't really ask. And actually getting that sort of feedback from people is really helpful. So it sort of helps guide your questions and how you work in the future. So I'm hoping that if I do all of the above, then it'll all go smoothly.